So a warm welcome to all the students. First of all, this is a very important case presentation, and your practical exams are right round the corner, and you need to really gear up to have a good presentation as well as a good question answer session so that you clear your exams with flying colors. So without wasting much time, let's begin by introducing our speaker today, the PG student, Dr. Palak Chavda. She is from Bhilai, Chhattisgarh, and she is an exam-going DNB resident. And I wish her good luck for this presentation as well as for the exam. And today we will be discussing a very important and a very unique topic, and that is anesthesia for robotic surgery, specifically robotic urological surgeries. So, robotic surgeries have taken the OTs, especially the perioperative care, by storm, and they have, in fact, posed greater challenges to the perioperative physicians, to the anesthesiologists, to modify their line of management in all phases of anesthesia, preoperative, intraoperative, and postoperative, and to cater to the enhanced demands of this technological surgical advancement. Anesthesiologists have really done a great job in facilitating such advanced surgeries without any fear for the patient and improving patient safety at the same time. So the anesthesiological considerations are very unique to this surgery because of various factors which will be discussed in the due course of the presentation, and several important points which have to be kept in mind during the perioperative period so that patient safety is not compromised. Okay, so now I invite Dr. Palak to start with the case presentation. Dr. Palak, please.
Good evening, ma'am.
Good evening.
I'll start sharing my PPT. So today I'm presenting a case of 68-year-old male patient who is retired by occupation, used to work in a steel plant, and who belongs to middle class according to the Kuppuswamy socio-economic status, and he is a resident of Bhilai, Chhattisgarh.
So what do you infer from this first slide about the case you're presenting? Can you go back to the previous slide?
Yes, ma'am.
Yeah. So what is your inference relating to perioperative management?
Yes, ma'am. So first of all, if we see, the patient belongs to the elderly age group, as he is 68 years old, and any patient above 65 years old would be considered as elderly, and anesthetic consideration in the elderly age group is different than the normal adult or any other patients.
Very good. Very good. Next slide, please.
Yes, ma'am. So he came with the complaint of trouble urinating or decreased force of stream and unexplained weight loss. In the history of presenting illness, patient was asymptomatic before 5 months. Then he developed dribbling of urine and had decreased force of urinary stream. There was 1 or 2 episodes of blood in the urine too. Patient also developed loss of appetite and unexplained weight loss, again along with the urinary symptoms. He was catheterized to relieve the obstructive symptoms, and he had also history of fever, which was treated with antibiotics. There is no history of abdominal pain or vomiting, no history of back pain, no history of jaundice, itchy skin or right upper abdominal pain, no history of headache, seizure, memory issues or weakness in limbs. No history of any ocular problems like glaucoma in the past.
Okay. So can you go back to the previous slide?
Yes, ma'am.
Yeah. So what is your take-home message from the chief complaint which the patient is presenting? Like, for example, decrease in urination or dribbling or force of stream, as well as weight loss, unexplained weight loss. So both of the things, what do they suggest the patient is suffering from?
So, ma'am, trouble urinating or decreased force of stream is the classical symptom of any obstructive pathology.
Obstructive uropathy or any obstructive pathology in the urinary system or genitourinary system. Yes, ma'am. And it is the age which is important. The patient is above 65 years, and these are the patients who are prone to develop problems with their urinary system in the form of prostate enlargement. And this is a very typical symptom, and it is also a symptom regarding the problem of urination in such age group. And what about unexplained weight loss?
Ma'am, generally the benign prostatic hypertrophy is not accompanied with unexplained weight loss. So
Yes.
unexplained weight loss gives the key to that this obstructive uropathy is mainly of cancer origin. We can investigate further. So it is giving the clue that it is
Yeah.
of cancer
Yeah, so it
etiology.
could be because of cancer or it could be because of any other chronic diseases or illnesses and specifically tuberculosis in India. So
Yes.
tuberculosis in India, you should never forget that is also one of the main reasons for unexplained weight loss. Yes, please.
Yes.
And then the next, that is the history of present illness. It shows that the patient also has blood in the urine. So what does this suggest? Along with loss of appetite and unexplained weight loss with urinary symptoms. So what is your inference about this?
Maturia is also one of the main chief complaint when it comes to the etiology of the prostatic hypertrophy. So it also points towards the cancer etiology.
Yes.
And
So this patient could probably have some oncologic problem as well. And another history which you have suggested is that the patient has fever, which has been treated with antibiotics and he has been catheterized before. So what anesthetic concerns are important in this particular history?
so, ma'am, the patient was catheterized, so recurrent UTI is there.
Yes.
And as the patient must be suffering from any oncology etiology, then patient must be having some history of chemotherapy or radiotherapy after investigating further. So we should inquire about that.
So basically, the patient has had previous history of UTIs, recurrent urinary tract infections, which has been treated with antibiotics. So this
Yes,
is a
ma'am.
patient who is prone to bacteremia.
Yes,
Okay.
ma'am.
So this patient can sometimes present with even sepsis or bacteremia to you, and these patients may also require post-operative ICU care. For example,
Yes,
these patients, once they are controlled with
mm,
antibiotics and then taken up for surgery, and after the surgery there is a very high chance of bacteremia developing, and these patients may land up in the intensive care unit for a prolonged period of time for optimization. Is it clear?
because of immunity suppression. Yes, ma'am.
Yes, yes. And repeated catheterizations also give us an idea that there could be trauma. That
Mm,
patient may have urinary trauma, that urethral trauma, because
mm,
of repeated catheterizations and more chances of infection. Okay.
yes, yes.
Okay. So why did you take a history of ocular problem or glaucoma in this patient on headache and
Uh,
seizures?
Headache, seizure, and memory issues. I wanted to ask because most of the time the prosthetic surgeries nowadays in this era, I prefer to do under robotic surgeries. And robotic approach is that in this surgery we do steep head low positioning along with the
What is it
pneumoperitoneum.
called? Steep head low positioning. What is it called?
Steep
Yes,
Trendelenburg
yes. So
positioning.
you have to use the proper term in the examination.
Yes,
So
yes,
steep
ma'am.
Trendelenburg position. What is the relation between headache and glaucoma with steep Trendelenburg position?
Because when we give the position like steep Trendelenburg along with the pneumoperitoneum, it increases the intraocular pressure and intracranial pressures also.
Very
So if
good.
my patient is having any intracranial pathology which he was treated before, or any history of stroke or anything, so I have to inquire about that to be cautious while giving the degree of head low positioning, so that we can minimize the
Yes,
ocular and intracranial complications during the
yes,
surgery.
yes. Why did you inquire about the history of back pain and history of jaundice and right upper quadrant pain?
Because, ma'am, prostatic
Pleuritis?
cancer is very notorious to cause metastasis in bone and liver and brain.
Very
So,
good.
most of
Very good.
symptom of metastasis in the bone is back pain. So,
Yes,
vertebra is involved.
yes.
And to inquire about
So
liver,
spine tenderness or bony tenderness in the back and generalized back pain or any specific point back pain must point out towards further evaluation. And if you are already dealing with a case of prostatic cancer, you must evaluate for metastasis. Okay. So that is the most important thing.